Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina, and today I want to talk to you about carpal tunnel and what is the best treatment for carpal tunnel. So it's interesting. As with any condition, there are different degrees of severity. So depending on how bad your problem is, it's going to dictate the treatment that you get. Okay, so that's first thing to understand. So if you have carpal tunnel that is coming from compression of the nerve in the wrist, if it's not severe, then we can probably help you to improve it pretty quickly. If you have a more severe form of carpal tunnel where you have multiple points of crush or of entrapment of the nerve, so you have it here at the wrist, maybe you have it in the forearm, maybe you also have it in the neck, then it's going to take us longer and we're going to have to apply multiple therapies. If you have severe carpal tunnel, where you have no muscles in the hands and it's very progressed and it's been going on for 20 years, and then I could do an exam with you, but most likely you're going to be someone that's probably going to have to go to see a surgeon for carpal tunnel surgery. So there's a lot of different things to consider. The one thing I'll tell you is, always consider starting with the least invasive, least dangerous approach first. Because once you go in and cut the wrist, once you have surgery on your neck, because a lot of people that have carpal tunnel have compression of the nerves in their neck that's causing the pain down in their arms. Once you have these surgeries, once you have injections, you're permanently changing the tissues of the body, and you cannot go back from that. So start with a conservative therapeutic approach first. See if that's going to help. We always do trials of therapy with everyone that comes into our office. It's never just carpal tunnel. It's every single person that comes into our office. We do trials of therapy. We actually chunk our treatment in 2-week increments. So we see people usually 3 to 4 days per week for 2 weeks, and we evaluate how they're doing. If they're not making any improvement in 2 weeks, then what we're going to do is we're going to say, okay, can we change? Is there anything else that we can do? Can we change our approach maybe for another 2 weeks to see if it's going to benefit you before we give up on a non-surgical approach, right? I mean, that's what we do. And that's really, I think, the best way to approach it. If we don't see any changes in 2 weeks, then we have to consider what else is going on, what else is driving the carpal tunnel. And is there something that we're missing? Can we, what can we do different to try and help you? And if you don't get better, in a second 2-week trial, then we've probably exhausted everything that we can do, and it's time for a referral for a surgical consultation. So I hope this helps you to better understand carpal tunnel, what the best treatment is. The treatment is really the treatment that is best for you. In our clinic, we use things like non-surgical spinal decompression, superpulsed laser therapy, which is non-burning, non-thermal. We use peripheral nerve rehab therapy. We use oxygen therapy. We use vibration therapy. We use joint manipulation, soft tissue work. We have a dozen or more therapeutic approaches that we can apply that are advanced therapeutic approaches that help nerve pain and healing. We work a lot with peripheral neuropathy, which is a nerve pathology. It's similar in a lot of ways to carpal tunnel. So I have a lot of experience looking not only physically, but also biochemically. If you're really inflamed, if there's a lot of other problems like blood sugar problems, then you have to address those things as well, or you're not going to heal. Right, so I try to look at people from as many perspectives as possible so that we address the whole person and everything. If you completely ignore your body chemistry and you have blood sugar that's off the charts, well, guess what? Diabetics develop neuropathy. They develop damage in the nerves in their hands and their feet, and it makes it very, very hard for you to heal. So there's just several things that we want to consider, we want to look at to determine what's best for you. But I hope this helps you to better understand, the best treatments for carpal tunnel. If you have any questions, if you'd like for me to take a look at your carpal tunnel, give you my opinion on your case and whether or not I think I can help, just give us a call at 828-324-0800. You can also find us online at hickoryspine.com to learn more about our clinic. I hope this helps you out, and I hope you have a wonderful day. Thanks.